Welcome, Dr. Sumit, on the occasion of Multiple Sclerosis event organized by Artemis on World Multiple Sclerosis Day. My first question would be to you is what exactly is multiple sclerosis for a layman to understand that?
Yeah, so our nerves are like wires. They have a central core and they have insulation over the copper. So this insulation is called as myelin, and it is basically responsible for a better conduction of impulses from the brain to the body. In multiple sclerosis, because of some unknown reasons, your own immunity becomes your own enemy. It could be incited by some clinical event, it could be incited by stress, by a viral infection, and sometimes without any cause. So once your autoimmunity is active, then it tends to damage this myelin sheath, which is the insulation. Because of this insulation, the current is transferred from brain to the muscles or to the body in an undiffused fashion. When this myelin sheath, which is the insulation, tends to get damaged, these impulses, they tend to get distracted, they might go to some other place, because of which the patients develop different types of symptoms. Now these symptoms could be decreased vision, it could be double vision, it could be imbalance in walking, it could be weakness of one side of the body, it could be weakness of both the lower limbs, it might be a problem in which one side of the face might become numb. So any symptom can be there in multiple sclerosis, but the reason is an autoimmune phenomenon which has damaged the insulation over the nerves. And patients tend to have these attacks repeatedly. So if you have an attack today, you might be okay for a month, you might be okay for a year, you might be okay for 6 years, 10 years, and then you might have again such an attack. Over the period of time, this insulation, once it's damaged, it tends to make the nerves brittle, which is called as a sclerosis. So multiple attacks of these autoimmune attacks on the nerves causing drying up of the nerves is called as multiple sclerosis.
Thank you so much, sir, for explaining this in a very layman's term to us. But if I have to talk about what is the theme of this year and what emphasizes are we giving this year?
Yeah, so Multiple Sclerosis Day is evaluated and commemorated all over the world on the 30th of May. We do it very actively because we tend to focus on one particular type of disease at our center. So we might have a person who's looking after multiple sclerosis, one who's looking after epilepsy, one who's looking after stroke. So multiple sclerosis we commemorate on this day in order to make people aware about the disease, to make people understand that this is treatable properly, that it needs to be understood that it is not a disease which is incurable. Patients can live well with multiple sclerosis. So this year's theme for this MS Day is Navigate Multiple Sclerosis Together, which means understand this disease and follow its progression or regression or attacks thoroughly.
Thank you so much for your insights and sharing your experience, sir. Thanks a lot.
Thank you.